Good afternoon, Pranav Da. Welcome from Wales. And today we're all actually three variably experienced examiners, and what we want to do is share our experience on how not to fail the FRCS Ortho. And remember, for many of you, it will be a day of performance that actually, for not everybody, it will be a great day. But what you need to do is be sure that you pick yourself up and carry on in order to go on to your next performance. There are lots of people who have not passed the FRCS or the first time. But with all good sportsmen and all good elite professionals, preparation is in fact the key. And you'll hear many of your colleagues and many of the trainees saying it's 6 months of your life that actually is intense and that you have to put aside in order to revise and get through the exam process. But I'm putting it to you that it's not in fact 6 months of your life. It's in fact the tip and the pinnacle of your trauma and orthopedic surgical training career. And actually that forms the basis of how you should plan your career pathway and the strategy throughout your higher surgical training. And again, you're not passive in your higher surgical training process. You are there to guide and navigate your way through the multiple specialties, providing the foundation and the base by which you can base the rest of your orthopedic career. And in fact, if you do that, the FRCS Ortho should be a fairly straightforward process. It is a test of your experience and your practical knowledge throughout your higher surgical training. And the ISCP guides you through that process. And I suggest that for both UK trainees and non-training applicants to the exam, that actually no matter where you are, you always formulate your higher surgical training and your lead up to the exam by the ISCP process. And therefore, you should not be aiming to sit the exam too early. And remember, our brains all age very, very quickly. And so you shouldn't leave it too late because you're not receptive particularly well to putting yourself through the rigorous task of putting the work in and answering the questions and putting the resilience. And again, you get to a stage in your career where actually doing exam may not be that attractive. So if you're going to plan to sit the exam, commit to your pathway and don't change your mind. Get involved early. Get involved with trauma meetings, with study groups, get used to communicating and talking about things that you may not know about. Asking questions, learning from other people is how you acquire a lot of your practical knowledge. And also it allows you to be able to discuss, to strategize. And again, that then is translated over into the exam, where you should see it as a two-way discussion with your colleague on day one of becoming a consultant. And actually you learn a lot from your colleagues. You are not in competition with them. You will all pass on the day if you are all good enough. So actually learning from each other and sharing experience is a really good and valuable thing. And there are many, many online resources now that are available to you. And so you don't need to necessarily rely on big textbooks. These websites will all guide you through the educational resources required of you. And again, if you belong to a particular region, and in the Welsh Deanery, we have our own online resource where previous trainees have put their experiences down of the exam. And that can be really good practical advice. And many of you will have access to your own deanery websites. But you should all start at the syllabus. And the syllabus is available on the JCIE website. It's downloadable. And again, remember, the question bank within the examination is vast and it covers the syllabus. So actually, it's fair game to ask you anything which is within that syllabus. So if you are not prepared and you haven't read the document, then you are putting yourself at risk of not performing very well. And the JCIE is full of really good advice on how to apply and again, how to prepare yourself for the exam. So this may be obvious to very many people, but you must have passed your FRCS within one of the 4 Royal Colleges. You must have sufficient experience, and they define that as a minimum of 4 years appropriate surgical practice. And that will be in trauma and orthopedics. For international trainees, they require a minimum of 1 year in the UK. But I suggest to you that first year in the UK, will you be settling in and understanding the system. So don't rush in to completing the exam. It is costly and it does take a lot of time and effort. You will need 3 structured references from your locality. The first part of the exam is only a question of knowledge and technique on how to answer multiple choice questions and single best answer questions. And actually, the only way to get through that is to do the bookwork and to practice lots and lots of similar type questions. Many exam type educational theorists have looked at success in exams, and actually learning the technique of a particular exam is key to success. It's not necessary how much knowledge you may have, but how well you can actually technically complete the exam paper. So this part of the exam needs you to go through hundreds of multiple choice questions and support that with reading around where you acknowledge that there are gaps in your knowledge. The section 2 is currently a combination of clinical examinations and oral examinations. And I think James later on will go through that a little bit further for you. But remember, during COVID, we've currently had no patients within the clinical examinations. You will be shown clinical photos, but remember to still be patient-focused and not examiner-focused. The plan will be to reintroduce patients for clinicals after February 22. So you will need to carry on with clinical examination techniques and interaction with patients thereafter. So these are my top trainees tips. I have been a consultant for 8 years, so I think it's probably not that long ago when I remember doing the exam, but these are the tips from the trainees in our region who have recently completed the exam. Work hard. There's no getting around that. And it's not work hard for 6 months. It's work hard for 4 to 5 years going up to the exam. And work hard in a way that you know how. Nobody can tell you how to work. We all work differently. So whatever technique that you've used in the past, you are all great at passing exams. So you've been successful in the past. You know how to work hard. Warn your family, but they will still need you. So you cannot hide away for 6 months. Put time aside in order to have valuable family time, and then you'll be able to last the course. Talk lots to anyone who will listen. One of my trainees says, talk to the mirror, talk to the dog, talk to whoever will listen to you. But again, it's good to have a buddy who you can start the communication process very early on. And when you start the communication process, learn to slow down, learn to think about what you're going to say, learn to be efficient in what you say. There are loads and loads of online courses out there now to support you. Pick the one that you fancy. They're all great. Arrive in a comfy hotel the night before, not the morning before. We've had flights that have been cancelled, we've had traffic jams and candidates not turning up. You will not be let into the exam. You need to arrive the night before. You need to relax. You don't need to open a book unless you've got some quick things to look over. But ideally, you should eat, you should sleep, you should relax, and then repeat that the following night. You don't need any equipment because there are no patients. Currently, refreshments are provided, so keep your energy levels topped up. The exam is long, it is hard. You need to be on top of your game, and so you need to keep your energy levels up. But you need to also relax in between each of the stations when you can. Be confident. Again, your patients want you to be confident on day one. We want you to talk in a confident manner. Don't say, I have never seen this before. You should still know the principles of what you are looking at. And actually being confident about it will mask the fact that you have never seen these before, if your knowledge and principles are correct. Imagine that you are talking to a colleague. We are all fairly friendly examiners, and we all want you to pass. So imagine you are discussing something with us, and then it should be a fairly relaxed interaction, which is what it is the most of the time. If you have a bad station, because some of us did and some of us will, just forget about it. There is plenty of flexibility within the system for you to make it up later on. It's a fair exam, and all the trainees come out saying that. But if you fail, you've just had a bad day. That's all it means. And you get back on the horse straight away and you keep working and you just go for the next diet. So my examiner tips, and mine may be slightly different to James because he is a lot more experienced than I am, but I like to see a trainee that comes in and a candidate that is professional. In April sitting, there were trainees with their ties undone, with hands in their pockets. If I was a mother asking you to operate on my child and you came up to me like that, I'd wonder that your attention to detail in the operation isn't as good. So you have to act and come across professional. Do not worry if the examiner does not give you any non-verbal cues and appears neutral and indifferent. We are told to be that way. We are not meant to give you clues because in the exam we don't know how you are going to do overall. So we may appear a little bit cold and indifferent at times. Listen to and answer the question that is asked. Don't give us the answer to the question you think we are going to ask because it wastes time. If you do not understand, ask the examiner to repeat the question. Having face masks is really difficult now, actually, and sometimes makes it difficult to hear. So if you do not understand, it's quite within your right to ask the examiner again. And be prompted by the examiner. The examiner will sometimes say, is there anything else you might want to consider? Are you sure about that? Be prompted by them. And because some candidates do not take the prompt and they will continue down a pathway which may be wrong. Do not offer irrelevant information. You are wasting time. Pace yourself. Do not go out of the gates like a racing horse. It's really difficult to pull back a candidate that has gone so far down the wrong path because they're just reeling out 12 causes of a condition. And actually, we don't want to hear that. So think about what you're saying. If you do happen to have pressure of speech and talk really quickly, practice slowing yourself down. Do not argue with the examiner. The examiner, on the whole, will always have a little bit more education and knowledge than you will. And actually, if you start arguing with them, you probably will put them into a bad mood. Do not say that you would refer to a specialist. you are the specialist and you should know the principles of treating that patient. So don't say that, because again, it just becomes a little bit frustrating for the examiner. And again, the opening questions are usually straightforward, so get the basics correct. And then expand with the more higher order thinking, support with the evidence, literature, national standards, etc. Because if you get the basics right and you don't really know any evidence, that's usually sufficient to get you through that station. So this is an example. And again, this template is on the JCI website, so I'm not telling you anything you shouldn't already know. And most of the questions follow a fairly predictable pattern. And the opening question is normally fairly straightforward. And this is an obvious supracondylar fracture in a child. But as an examiner, I wouldn't expect you to say, I would treat this along ATLS principles. Children who sustain this injury are not usually polytraumatized, okay? I get you're trying to be the confident and the thorough individual, but actually it's not relevant within the exam. And you may be taught that in courses just to be thorough so that you don't miss anything out. But actually, we're not interested in that. And equally, I'm not interested in this is a radiograph of an immature skeleton. Of course it is. You don't see supracondylars like this in a mature skeleton. Well, very infrequently anyway. So again, you are wasting time. However, the candidate who tells me I can see ecchymosis in the antecubital fossa, this is worrying for me, as they may have buttonholed through brachialis, making my job in theatre a little bit more difficult. All of a sudden, I'm thinking, this trainee knows what they're talking about. I'm going to push him to a 7 or an 8. So be very specific with what you are going to offer in the answer.
And this is the second short case. This is Mr. O'Brien, if you can come up to observe his shoulders. Yes, right.
So this is a clinical video that I'm going to show you. And this is just an example of one of our examiners going through a clinical case, just to show you the pace and approach by which you should take. Let me just try that again.
Okay, and this is the second short case. This is Mr. O'Brien, if you can come up to observe his shoulders. Yes. Right, so Brian, how are you? Hi, do you mind if I examine you? Okay. Right, so I'm just going to look at you to begin with. And just on observation, there's clear asymmetry in this O'Brien's upper limb girdle. Looking at the left-hand side, that's where the abnormality lies. There's quite dramatic wasting of the head major muscle, actually more so on the right-hand side there as compared to the left, whereas noticeable on the left.
So what I wanted to illustrate there is actually his nice pace, his approach to the patient, how he then was centered and listened to the question to examine this gentleman's upper limb and shoulders. And again, many of the points that you will get from this will just be on observation and description. Now, COVID has meant that we can't use patients at the moment. So we've gone to using clinical photos. And this is an example of now how we would run that exact same scenario, but in photographic form. So we may say to you, this gentleman presents with bilateral shoulder weakness. Please, could you examine his shoulders? And you would look at the photographs in turn, and you would describe what you would do to the patient, okay? And how you would look, and you're looking specifically for asymmetry. And then the examiner may prompt you to see there may be some atrophy or weakness, or there may be scars, and will prompt you along the way. But you are still focused on the clinical examination. And again, if you look down at the bottom right-hand corner, the examiner may say to you, well, why in this shoulder exam is the patient showing you his teeth? And again, you're meant to pick up that you are looking for weakness in the facial musculature to see if this is associated with a facioscapular humeral dystrophy. So remember, only a small amount of the marking descriptors are on knowledge and judgment. It's about how you speak and your approach to the patient. Again, higher order thinking comes in the 7s and the 8s, and that is what you should be aiming to achieve. Because then that allows you to have some bad performances in some of the stations. So my final slide is be prepared. You will have a good performance and you will go away happy. Thank you very much.